Type 2 diabetes is, one of the most common chronic diseases today. It actually affects about 80% of diabetes patients. The main issue? Well, the body's insulin-producing beta cells slowly stop working properly. As long as they can keep up, blood sugar remains normal. But eventually, blood sugar rises, leading to some pretty serious complications. Why is type 2 diabetes dangerous? When blood sugar stays high, it causes oxidative stress. Harmful compounds like advanced glycation end products and reactive oxygen species damage the blood vessels. This can lead to problems such as eye disease, kidney failure, nerve damage, heart attacks, and strokes. Other risk factors like high blood pressure, high cholesterol, obesity, and inactivity make type 2 diabetes even worse. Especially with obesity, fat tissue releases chemicals that cause inflammation and insulin resistance. Curcumin's potential is honestly pretty fascinating. Curcumin, the active ingredient in turmeric, has shown great potential for treating type 2 diabetes. It actually has antioxidant, anti-inflammatory, and blood sugar lowering effects. This information is based on a 2021 systematic review titled The Effects of Curcumin on Diabetes Mellitus, published in Frontiers in Endocrinology by researchers from the University of Marília, Brazil. However, curcumin does have a big problem: low bioavailability. It doesn't dissolve well in water and is quickly broken down inside the body. Most of the curcumin we eat either isn't absorbed or is quickly eliminated. So, to solve this, scientists actually developed better delivery systems like nanocurcumin micelles, solid lipid particles, and also hydrophilic nanoparticles. Other tricks include mixing curcumin with fats, black pepper, or even lecithin. These methods can, boost curcumin's absorption by 15 to 20 times. This way, curcumin stays longer in the blood and becomes more effective. Clinical studies on curcumin and type 2 diabetes have been, quite interesting. Multiple clinical trials have tested curcumin's effects. Some studies showed that curcumin lowered blood sugar, HbA1c, and body weight. Others found it improved cholesterol levels by increasing good HDL and reducing bad LDL and triglycerides. Curcumin also reduced inflammation and oxidative stress markers in many patients. And, some studies even showed improvement in mental health, kidney function, and diabetic foot ulcers. However, it's important to note that many studies had limitations, like small sample sizes, short durations, or low doses. So, is curcumin safe? Well, curcumin is generally safe even at high doses, up to 6 grams per day in some studies. Side effects are usually mild, like nausea or diarrhea. However, it can interact with medications like blood thinners and diabetes drugs, so it's important to consult a doctor first. Overall, curcumin looks like a promising supplement for managing type 2 diabetes, but more large-scale, long-term studies are needed. If you found this video helpful, don't forget to like, share, and subscribe. And stay tuned for more science-backed health updates.